Hi, everyone. Sorry about the little bit of a delay in starting. We will wait one more minute to allow people to join, and then we will start our Facebook Live event. Thanks. So hi, everyone. I think we'll go ahead and start. I'm Dr. David Buchholz. I'm a general pediatrician and the senior founding medical director at Columbia Primary Care in New York City. Welcome to Fight the flu vaccine in the age of COVID. So, we're going to be addressing 5 major themes this afternoon. For some of you, it's probably still morning. One is, what is influenza? Flu for short, and why do we vaccinate against the flu? The second major theme is just what are the flu vaccines that are available this flu season? I want to make it simple and easy so that you know what your choices are. Who are the candidates for flu vaccine? What precautions can you take to prevent yourself from getting the flu, even if you've already gotten the flu vaccine or in addition to the flu vaccine? And then finally, flu during the COVID-19 pandemic. And in fact, probably throughout this conversation, I'm going to be throwing in some comparisons between flu and COVID-19 because there are some remarkable similarities in symptoms, what we do to prevent it, and what are potential choices in the future for treatment. So first of all, what is flu? Flu is really a very specific disease caused by a group of respiratory viruses. And those viruses, the most common ones that people think about are influenza A and influenza B. And I call those out here because our vaccines are meant to protect against those 2 viruses. There's actually an influenza C and others that people often don't think about or talk about. On average, about 8% of the US populations get sick from the flu each season from one of these viruses. But interestingly, a lot of people get infected by the flu and never have symptoms, which is one of those examples of, if you've been following the news about COVID, there's a large number of people that actually have COVID but never have symptoms. So what are the symptoms of the flu? When I am in clinic seeing patients and someone walks in with influenza in the pre-COVID world, I can quickly just look at them and go, I bet you have influenza. Because the people that really demonstrate the classic symptoms are really feverish. Children will have fevers of 104, adults 102 sometimes. They'll have chills, which are just shakes. They'll have a cough and a sore throat, occasionally a little bit of runny nose and congestion, but that's not a big part of it. They'll complain of significant body aches, have headaches, and they'll be really tired. And also kind of interesting with the flu that if you overdo it, you think you're getting better and you start to get active again, you can relapse and get all of these symptoms worsening again. Occasionally children will have a little bit of vomiting and diarrhea with the flu, but the reality is children will have vomiting and diarrhea with practically anything. But that's a minor part of influenza. So it's just some interesting flu facts that you can share with family and friends. Children are actually more likely, twice as likely to develop a flu infection with symptoms than older adults. So often people think of influenza as a disease of seniors. It really affects all of our population. And as I said, children are more likely to get symptoms. And people with flu are most contagious in the first 3 to 4 days of the illness. It's usually when they're having their fever, because the fever can last up to 5 or 7 days, but it's first 3 or 4 days. And people can also be very symptomatic 24 hours before they're actually showing symptoms. And so if we're relying on isolation, staying away from people with symptoms, we can still get flu because of that 24-hour span before symptoms appear that you can spread it. That's also not unlike COVID. And then I call this out here. We have this unfortunate name for a thing called stomach flu. That's gastroenteritis. That's what children often get, and adults too, but it starts with vomiting, and 12 to 24 hours later, there's lots of diarrhea. That is not caused by influenza A or B, and that is, we don't have a vaccine or a set of vaccines for stomach flu. So why do we vaccinate against flu and maybe not other cold viruses? It's because of the complications that flu can cause. I mean, during the 7 to 14 days that you can be pretty sick, you might wish you never had it, but most people get better. But there are complications, and there are some moderate complications. Sinus and ear infections can happen from the flu, but they can happen from almost any respiratory virus. Pneumonia is actually a potentially serious flu complication that can actually, the virus itself can cause pneumonia, but you can also get a secondary infection or a co-infection with bacteria, often a bacteria called pneumococcus. And also flu, as opposed to other respiratory viruses, are more likely to exacerbate chronic illnesses like asthma and chronic obstructive pulmonary disease and heart disease. The most serious complications from flu and why we vaccinate and try to protect us from getting it, well, I guess the obvious one that's not on the slide is you can die from it. In fact, tens of thousands of people die from influenza in the United States every year. But you can get inflammation of the heart. It's called myocarditis. You can get inflammation of the brain, inflammation of muscles. You can have organs that fail, particularly the lungs and the kidneys. And you can have sort of a extreme inflammatory response by the body that we call sepsis. And the body is trying to fight off the infection, but it overwhelms us. You know, this list of possible serious flu complications look a lot like the serious complications people get from COVID. This is what often kill people in the hospital. So when should I get the flu vaccine? Well, most importantly, you want to get it before flu shows up in your community. So that means you need to get it in the early autumn. September and October are ideal. Particularly for people that aren't infants. We actually can sometimes give flu vaccine to a 6-month-old even in August because they need a 1-month booster. But for the most part, people should get in September or October because flu tends to start to show up in November. And then what are the vaccines? And they really come in two types. There's only 4 vaccine types overall, but you just start out with trivalent and quadrivalent. Trivalent just simply means that we are protecting against 3 strains of influenza A and B. Quadrivalent just means that we're protecting against 4 strains of influenza A and B. You know, the trivalent vaccine, the only one that's really available in the United States this year, is meant for seniors. It actually has some additional ingredients that make the vaccine a little bit more potent because people 65 years in age and older might not develop quite the immune response that we hope for. And that trivalent vaccine can help ensure immunity against those 3 strains of influenza. The quadrivalent comes in 3 forms. It's the standard flu shot that practically everyone will get. There's a high dose version for 65 and older for the same reasons I talked about in regards to the trivalent. And then for those people that are a little bit shot shy, there is actually a live attenuated nasal spray. It's a vaccine that gets sprayed in your nose, and it's only approved for people between the age of 2 and 49. So what are the side effects? And I'm going to really spend a little bit of time here because there's a lot of myths about that, and we'll be addressing that here in a second. But these are the potential side effects of flu vaccine. The most common, and the thing that I even will complain about, and that is you get soreness, you can get a little bit of redness and swelling at the site of the injection. You know, we inject it into the deltoid muscle, and the deeper it goes into the muscle, the less likely you're going to get this kind of reaction. In smaller children, we put it in the lateral thigh. So we really do try to get deep into the muscle because, again, that minimizes that. The other thing that's often reported, usually in the first day or two, related to the actual injection, is you can get headaches, maybe a little grade fever, some nausea, muscle aches, and fatigue. It's usually incredibly mild and self-resolves after a day or two. But to be honest, this potential side effect is no different than if we injected somebody with a placebo. So if we take just a small amount of what's called normal saline, which is a typical body fluid, to be honest, and inject it into the muscle, just as many people after the injection of the normal saline will complain of these symptoms as people who get the injection of the influenza vaccine. So is it really a side effect of the vaccine? Probably not. It's probably more related to the injection. It's incredibly rare, but some people can have an allergic reaction to a flu vaccine. In the 30 years plus that I've cared for patients, I have never had a patient, I've never heard of a patient having an allergic reaction. And then finally, there is an incredibly rare association with this autoimmune disease called Guillain-Barré syndrome. It's probably 1 or 2 people out of 1 million people vaccinated might get Guillain-Barré. Guillain-Barré typically is a self-limited illness. It lasts for about 6 weeks. It's sort of a weakness of the legs. It sort of progresses up the body, and then as it resolves, that weakness resolves from the top of the body downward. Again, incredibly rare. And these are the side effects. These are the things to think about. The one that people should really care about or know about is really just the soreness at the injection site. You can always do a little massage or take some Tylenol or ibuprofen to help treat it. So who should get the vaccine? Well, everyone 6 months of age and older. We don't vaccinate children under 6 months simply because we don't. Children under 6 months generally don't get a good immune response. So if you have a child who's under 6 months of age, the parents and any caregivers really need to make sure that they're vaccinated to protect their infant. You know, most people who have an egg allergy should go ahead and get the flu shot. For years, we had some concern about that because their original flu vaccine was sort of grown in egg white. And if you had an egg allergy, we were concerned about an allergy to the flu shot. But the reality is that doesn't really play out. And so in this flu season of 2021, you know, the CDC is really recommending that all these people just go ahead and get an age-appropriate vaccine. And as I mentioned before, September and October are the best times to get it, but it's never too late. Vaccine is often still in supply late into the spring. And if there's still flu vaccine in your community, it's never too late to get vaccinated. So there are a few people who should not get the flu shot. And as I mentioned, children under 6, for the reasons I had said before, you just don't get a good immune response. And anybody who's had a severe life-threatening allergic reaction to the flu vaccine or any of its ingredients, which I also mentioned I have never seen, but I'm sure it's happened. And then You know, some people that have a history of Guillain-Barré syndrome should at least talk with their doctor to see if they should go ahead and get vaccinated. So I mentioned I was going to share some flu myths. You know, these myths come from all over the place. Friends, relatives, social media, the internet. There's a lot that sort of gets perpetuated in society. And I'd like to just sort of address some of them head on. So you can get sick from getting the flu vaccine. That's really not true. It's not a live virus. The injection is not a live virus. It's just a few protein components of the virus. It cannot spread from cell to cell. It just elicits an immune response. You cannot get sick from getting the flu vaccine. It's better to get sick with the actual flu than to get a flu vaccine. Well, I also think that's kind of interesting. And the reason I mention is for all the things we've already started to talk about. The side effect of a flu vaccine for most people could be just a little sore arm, but there are significant complications from getting the flu itself. The worst complication is death, and just like we had talked about. I had the flu vaccine and still got the flu, so it doesn't work. Well, you know, there are times with individuals, but also sometimes with seasons, where a person doesn't get quite the immune response that we had hoped, and therefore they may go ahead and get true influenza. But it still works. We do know that people who get vaccinated and still go on to get the flu have a much more mild illness than they would have. And there's been lots of studies that show that, where we actually compare people's symptoms of flu with or without a vaccine. The next myth, pregnant women shouldn't get the flu vaccine. In fact, not only is that a myth, pregnant women are one of our major targets for getting the flu vaccine. Pregnant women's immune systems aren't as strong as people who are not pregnant. And when they do get influenza, they tend to get a much sicker case, and they're much more likely to get the complications. So regardless of when a person is in their pregnancy, in October, November, we recommend getting the shot. And then if they get pregnant during the flu season and haven't gotten a vaccine, we encourage them to go ahead and get it regardless of how late we are into the season. So you don't need to get a flu shot every year. Well, that's also a myth. Influenza viruses, the A viruses, are particularly fascinating, and why we can't eliminate them from the world is they mutate season over season typically. And that mutation makes it so our bodies can't quite fight it. And therefore, the flu vaccine formulation tends to change year over year to fight the virus that tends to be in the community at the time. Flu usually starts in the southern hemisphere and moves into the northern hemisphere, so we can often anticipate what it's going to look like in the United States. We also know that if you get a flu vaccine, the immunity tends to wane over time, particularly more than 6 months after the vaccine. So boosting that immunity doesn't hurt either, particularly if maybe we don't get that sort of natural variation from season to season in the virus itself. And healthy people don't need to be vaccinated. Well, that's also a myth. We vaccinate healthy people because they can get complications. And sometimes we do things for society. And if we vaccinate everybody, we are also protecting those people who can't get vaccinated for whatever reason. And so we can protect everybody. And then finally, Flu vaccine will increase my risk of getting COVID-19. That is wrong. In fact, during this COVID season, one of the advantages of getting the vaccine is that if you end up getting really sick during the flu season and you've been vaccinated, it actually will help us determine more quickly that you might in fact have COVID and not the flu. So major myth. So what else can we do to prevent the flu in our homes and ourselves? And as I go through this, this should sound incredibly familiar in this day and age of social distancing and COVID. Well, the one thing we don't have yet for COVID is a vaccine, but we're all anticipating it. But we do have a flu vaccine, so that's where we start. The next thing is you can always wear a mask. That protects you by protecting your nose and mouth from getting respiratory droplets on them if someone coughs and sneezes near you, but also protects others because if you cough or sneeze, you tend to do that into the mask. Social distancing of greater than 6 feet helps reduce flu transmission. Washing your hands frequently, particularly if you've been outside or if you're about to eat. When you're ill, you got to stay home. Try at all times not touching your face during flu vaccine or flu season. It's transmitted through droplets, just like COVID. So if you have the virus on your hands and touch your mouth, your nose, or your eyes, that's how you're introducing it. Your skin is an incredible barrier to infection. Flu cannot get through our skins. It's really when we put our hands near our faces. And then if you could cover your coughs and sneezes, usually coughing into your elbow is a good thing. And then for flu, we have antiviral drugs. So if you've had an intimate exposure to flu and you're a high-risk person of getting complications from the influenza, you can call your doctor and they'll start you on an antiviral medication to help reduce your risk of getting the flu after exposure. So we've talked a lot about flu versus COVID-19. There's a few things that can help differentiate it. Probably the most important thing to know is we do have tests that can to test for flu and COVID. So if you're ever so sick that you need to be hospitalized or you end up seeing your doctor, we can do tests to differentiate the two. But the other thing is there are a few things that are found more often in COVID, and that's shortness of breath and difficulty breathing. It can happen if you have a secondary pneumonia from influenza, but shortness of breath and difficulty breathing seems to be a really common symptom from just having COVID. And the other thing that seems to be much more unique to COVID is a temporary loss of the sense of taste and smell. So flu during the COVID-19 pandemic. Why get vaccinated against the flu during the pandemic? We started talking about that. Well, get it now, because if we have another COVID-19 surge, there may be another lockdown, and there's even some neighborhoods and some states that are continuing to be locked down. And if there is, it'll be much harder to get the flu shot. Doctors' offices tend not to be seeing people in person. Pharmacies have been staying open, but they could have limitations in being able to administer the vaccine. Because flu and COVID have very similar symptoms, as I mentioned before, we'll be able to distinguish symptoms if you've been vaccinated and feel more confident that you have COVID. And because flu often puts a strain on our healthcare system, even in the most normal seasons, some of the worst flu seasons can actually almost completely fill hospitals. You can imagine with a combination of a bad flu season and a COVID surge, we really will strain our hospitals and healthcare providers beyond their capacity. I'm in New York City and lived through the March and April, May surge, and it put a strain on all of us. So flu during the COVID-19 pandemic, if you do get symptoms suggestive of flu or COVID, what should you do? And that's really is isolate and treat your symptoms. Seek medical care if you start to develop complications that could be scary, like shortness of breath or difficulty breathing. Make sure you call ahead to let them know that you're coming, because they're going to take all the precautions to protect other patients and healthcare workers. Make sure you wear your mask, those kinds of things. And then your doctor may test for flu or COVID and offer antiviral medications if you have the flu. So we have a list of frequently asked questions. These are things that we've heard in the community and from various places. And so if you do have some questions, go ahead and start submitting questions, but we're going to start with these. And some of this might be a little bit repetitive, but we thought it would be important to call out again. Can I have flu and COVID at the same time? Well, that's actually a great question, an interesting one. Usually viruses don't play well with each other. They almost put up barriers when you have a particular respiratory virus preventing other viruses from infecting the same cells. But it can occasionally happen, and there's been some evidence where flu has been in the Southern Hemisphere already during this COVID pandemic, where both people have had both flu and COVID. But again, that's been pretty rare. Just anecdotally, in New York State, we are now trying to test for both flu and COVID when anyone's symptomatic. And we might learn that it's actually happening more often than not, but that's still to be yet determined. The second big question is, will the flu vaccine give me the flu, make me sick, or weaken my immune system? And the answer is no to all of those things. The only side effect really would be that achy arm for the most part. It doesn't weaken our immune system. Our immune systems are remarkable. Our bodies can start to respond to all kinds of foreign antigens, foreign proteins simultaneously. I think anyone who's had a child in daycare or preschool knows that they are hotbeds of infection, and children will actually start to respond to everything they're exposed to and do it incredibly well and develop immunity over time to lots of different things. The third question is, I've heard that the flu vaccine makes it more likely that you will get respiratory diseases. Is that true? I thought a lot about this. I'm not sure what this came from, why people might think this, and the answer is no. It's interesting in that sometimes, particularly in children, again, I'm a general pediatrician, is that some parents will choose, right or wrong, to not give their kids flu vaccine if they're mostly at home as an infant or a toddler. And then they'll think, okay, I'm going to send my kid off to daycare or preschool because I have to go back to work or whatever it might be. And they decide, oh, I'm going to vaccinate my child against flu. The children who have been incredibly healthy with almost no colds will go to daycare or preschool, and parents will be often surprised that they get like 10 colds that cold season. And that's the normal thing that happens. So I could imagine a temporal relationship where people haven't vaccinated and now they choose to vaccinate because they're exposing their children to daycare. And then they see this huge increase in colds. And it's really not the vaccine that caused it. It's really the fact that children are around other kids that are sick. So as I mentioned before, our bodies can fight off multiple attacks by various infectious agents all the time. And just because our body fights off one doesn't mean we can't fight off the next 100 cold viruses. Who should be exempt from getting the flu shot? I kind of mentioned that before. It's really people who have a severe allergic reaction to flu, people who have who are under 6 months of age. Talk to your doctor if you've had Guillain-Barré syndrome. Does the flu shot wear off? Yes, it seems to. We get a really good immune response within 2 to 3 weeks of the vaccine. That's part of the reason why we do it in September or October, to get a good immune response before we might be exposed during the flu season, which could start in November or December. And then it tends to wane after a little more than 6 months and slowly disappears after that. It's part of the reason we get it every year and boost it. The next question is it true the flu shot doesn't always work? Yeah, it doesn't always work completely. We always seem to get some benefit from it each year. When we don't, it's usually from one of two things. It wasn't the perfect match for the viruses that are circulating that year. Also, sometimes our bodies don't have a good immune response to the flu vaccine. If someone's on chemotherapy or other immune suppressive medications for inflammatory diseases, they should still get a flu shot, but they may not get a great response from it, meaning that they might not get the immunity they need, but they're no more likely to have side effects than somebody whose immune system's intact. And then, are non-needle versions of the flu vaccine available? And the answer is yes. It's the Flu Mist. That's a brand of nasal flu vaccine. It just squirts into your nose, and you have to take a big sort of sniff upward to keep it in, and it works really well. There are a few people that probably should not get that vaccine, so if you're interested in a needleless flu vaccine, you should talk to your doctor. And with that, I think we'll probably be taking additional questions from our Facebook Live audience. And in the meantime, we have our commercial here. As I mentioned before, I'm the medical director of Columbia Primary Care in New York and Westchester counties. And you can see our website right there. You can always get care by just calling the 844-387-CARE number. We have telemedicine available for lots of things. We particularly like using telemedicine for people with flu-like symptoms and COVID-like symptoms, as we can often care for them over the telemedicine. So with that, I'm having some additional questions coming up. And then one of the questions was, I was confused by your explanation description of the various flu and pneumonia vaccines. Can you please explain again? Thanks. That was a Facebook question. Yeah, you know, there's influenza vaccines and there's also pneumonia vaccines. They are different. Pneumonia vaccines protect against a particular bacteria called pneumococcus, and there's two. There's Pneumovax and there's Prevnar, and we use Prevnar in children, and Prevnar and Pneumovax are highly recommended for seniors because seniors are much more likely to get these pneumococcal infections, and they're much more likely to get a pneumococcal infection if they also have influenza. So I think it's important to be aware that that's for that bacteria. And then the influenza vaccines protect us against the influenza virus, and then influenza could cause pneumonia, but we're really protecting against that virus. And there's the two types. There's the trivalent and the quadrivalent. But most importantly is they all work. Just get an age-appropriate flu vaccine. You can always ask your doctor about the specifics or your pharmacist when you get it. So another Facebook question, do you recommend a second dose 1 to 3 months after first dose due to how the levels begin to wane, especially for patients who have an underlying immune deficiency? Well, that's a great question. In general, no. Children, yes. Kids who get their very first flu vaccine of their life and they're under 8 years of age, or 8 and under, should actually get a second booster. And they should be at least a month apart. That's the only age that is generally recommended. So if you do have an immune compromise and you get your flu vaccine, I would actually ask your doctor if you should get a booster a month later. I would like to think that it wouldn't hurt. It could only help, but I would really ask your doctor specifically about that. Another Facebook question, according to a PubMed article, the flu shot increases other respiratory illnesses in children by a factor of 4. Is this true? I am increasing my child's likelihood of getting COVID by getting them vaccinated for the flu. Well, again, no. You know, there's, with all healthcare and medicine, we will often get 1 or 2 studies that actually will show something that seems like a surprise to us. And so we then do lots of studies, often really rigorously done studies with blinded studies. They're called cohort studies, where one gets one thing and another gets a placebo, all of those things. And we'll often disprove a particular article or particular study. I think one of the examples that's really commonly used is that there was a study in Lancet and out of the United Kingdom years ago about an association with measles, mumps, and rubella shot, particularly the measles shot causing autism. It was a really poorly done study. It was debunked actually by even the authors, and there have been hundreds of studies since then that shows no correlation, but often people will reference that one study. But so guess what I'm saying is you got to look at the bulk of the literature, do the analysis, try to determine what you think, and get to some consensus. I like to trust the science, and I think that helps. And then whether or not your child is more likely to get COVID, I addressed that before, no, because our bodies can fight multiple viruses, and vaccinations against one doesn't make it more likely we'll get another. It doesn't weaken our immune system. It's remarkable how strong our immune systems are and how targeted they can be. So another Facebook question, is it better to get the flu vaccine from your GP or from a pharmacy? It doesn't matter. It depends on the state too. For adults, you can always go to your pharmacy. Go ahead and go to your pharmacy, get your flu shot. If it's convenient, do it. They do a great job. You might want to share the fact, with your doctor that you got the flu vaccine so that they can record it and just acknowledge that you got it. They'll also stop bugging you to get the flu vaccine, so that doesn't hurt. In some states, children can get a flu vaccine in a pharmacy, and that can be age dependent. In a lot of states, children 2 years of age and older can get flu vaccines at the pharmacy. So just check with your sort of pharmacy to see if they're allowed to give flu vaccine to smaller children. Most infants probably should get it from their doctor. Next question is, can you go over I meant the third quad and senior vaccines once more? Yes. Quadrivalent vaccine is one of the flu vaccines that protects against 4 of the strains of influenza that cause disease. Trivalent protects against 3 of the strains. For seniors specifically, the trivalent is only approved for 65 and older, and it has a thing called an adjuvant in it that actually makes your immune system respond better. So if you're a senior, you probably want to either get the trivalent or the high-dose quadrivalent. Now, the advantage of the trivalent is that it hurts less. The quadrivalent, high dose, hurts more. You're actually much more likely to get an achy arm for 2 or 3 days. However, with the quadrivalent, you're actually getting a little bit more protection against one of the strains of influenza B. So you just have to sort of decide what you want to do. The vast majority of the strains that actually cause flu symptoms are actually covered by the trivalent. So if you don't like needles, get the trivalent because it's going to hurt less later, and then get the quadrivalent if you're not so worried about that. So another question, I am 64. Can I get the flu and pneumonia vaccines at the same time? Absolutely. So yeah, just go ahead and do it. Your body will respond to both equally. You'll get the same immune response to the pneumococcal vaccine and to the flu vaccine than if you did them separately. So again, that's part of our bodies being able to react to lots of different antigens or proteins that we give to us that can help our body respond to that thing in our body, so that when the virus shows up with that same protein on its surface, we can fight it off without it infecting ourselves. Next question. If this is my first time getting a flu shot, how will I know if I'm having an allergic reaction? Well, that's a great question. You know, the kind of allergic reaction we would really care about probably would happen pretty quickly. You'll start to get shortness of breath. You may get swelling around your mouth, in your airway. That is a 911 emergency. That means you truly don't spend time taking some antihistamine or doing anything like that. You call 911 and you get transported to the emergency room. Again, incredibly unlikely. I don't think I've ever heard of anyone actually doing that. You might want to ask your friends, have you ever known anyone who got a flu vaccine and got transported to the emergency room with epinephrine and all the treatment that we would do? But that's what you would do. Now, a lot of doctors' offices, if people have concerns, they'll go ahead and give you the injection, and you just let them know, I'd like to just be observed, and they'll have you wait in the waiting room, or they'll have you wait in the exam room, or wherever, so that you have an if you're going to start to react to it, there will be people readily available to care for you. Next question is, my mom is 97. Is the flu shot safe for her? She's on Coumadin. It is absolutely safe. She's not a contraindication. She may not get the best immune response. So I really, and a 97-year-old mom, would recommend either the high-dose quadrivalent or the trivalent vaccine, just to see if we can get a response. But absolutely, I would do that. Because she's on Coumadin, you want to get deep into the muscle. You also want to put on some pressure after the injection, because she may bleed from the side a little bit. But if it gets really deep into the muscle, that's still very unlikely. But yes, I would. If she has other contraindications, you might want to ask your doctor, but Coumadin is not one of them. To be honest, I'm a general pediatrician, but when I was in medical school, I actually had a patient die. She was 103 years old, and she died of influenza in the nursing home. And we gave her a vaccine, and I don't think she got a good immune response. But that's an example of an incredibly old person. Maybe I shouldn't say it that way, but an older person who probably didn't have a good immune response. So the next question is, what about redness and pain to the touch after a flu shot that doesn't go away for a few days? Is that normal? Well, normally you would expect in a normal dose flu shot that the pain will go away after a couple of days. If with the high dose quadrivalent shot for seniors, it could actually be 3 or 4 days. I recently got the Shingrix, which helps protect against shingles, and it hurt for 3 or 4 days. And so I think that's probably how the high dose quadrivalent feels. If it starts to get more red after 2 or 3 days, more painful, maybe you start to run a fever after 3 or 4 days, that could actually be a sign that, coincidentally, or maybe because of the injection site, a cellulitis, which is infection of the skin, is developing. So I absolutely would call your doctor, especially if you seem to be getting worse and not better after 3 or 4 days. Next question is, do I need the flu shot if there's herd immunity? Well, the way we get herd immunity is we get 95% of everyone vaccinated. So that's actually what we're trying to do, to get herd immunity, so that small subset of people who can't get the flu shot, maybe because they truly do have an allergic reaction, or whose immune system, who if they get the flu shot, they still may not get a good immune response, like the 103-year-old person I was talking about, or somebody on chemotherapy or immune suppressants. Those are the people that we're trying to protect with herd immunity. So if you're healthy and you don't have a contraindication to flu, I would say to the flu vaccine is get the flu vaccine. Don't try to participate as one of the people not getting vaccinated and hoping everybody else will. But that's just me. But I've never meant a vaccine I didn't like. I'm always first in line to get the flu shot. I think it's something that we do for ourselves, but it's also for our family and friends. So now the question is, how does a flu shot affect my body's immunity overall? Well, it only boosts it because we're injecting a few proteins from the surface of the virus. Our body's reacting to that, developing antibodies in a cellular response. Just like in the question with the vaccinating against pneumonia or pneumococcus at the same time, our bodies equally respond. So the more we're exposed, the less to a variety of things, the less likely that we're going to get ill because our bodies truly do respond. As a general pediatrician, early on in my career, I was exposed to everything. And I literally have not missed a day of work for illness, for acute respiratory illness in the last 30 years. Because I swear I'm immune to everything. Now I'm going to turn around and get sick. But I'm wearing my mask and social distancing, so that's unlikely. Would you test for influenza titers to determine response to a patient has an underlying immune deficiency? No, but we do something really similar. One of the things we test for is antibodies against measles. For people who've been vaccinated as a kid against measles, who we think they may not have a good cellular immune response, we actually do test immunity and in a variety of ways. So we do often test if someone has an immune deficiency based on their childhood vaccines. And the next question, is the flu shot free? If I don't have insurance, how can I get a flu shot? Flu shots, first of all, are really cheap, but sometimes that's all a relative thing. Almost every public health department will offer free vaccines. So just go to your public health department. In New York City, I think you can dial 311 and just ask, where can I get a flu vaccine? And lots of cities have similar phone numbers to help you access it. So I'm just getting a nice alert saying it's all for me. Thank you, everyone. I really appreciate you joining this Facebook Live event. I have enjoyed it. I hope to do more in the future. Don't forget, I'm the Senior Medical Director for Columbia Primary Care in New York and Westchester counties, and I'm a general pediatrician. If you ever are in the area, if you live here and you need care, feel free to contact us. We guarantee same day, next day appointments. Thank you so much for joining us.